The name of the organization is Family Health Alliance, and my name is Tara Nisongi. I became interested in this line of work to see how women in rural areas can have access to family planning methods. And the reason being is that family planning is a major strategy in reduction of maternal mortality. And our work in Afghanistan focuses on reduction of maternal mortality, and we've chosen family planning as a strategy to address this issue. Afghanistan has the second highest maternal mortality rate in the world and one of the highest fertility rates in the world. So an average woman in Afghanistan gives birth about 6 times during her reproductive years. So you can imagine there are women that give birth 7, 8, 9, 10 times. And one of the main reasons is of maternal mortality is having children with no birth spacing, and that is what we focus on. Birth spacing is what is used in the region, in the area, and what it really means is family planning, but culturally is more accepted if you refer to it as birth spacing. So that's what we refer to. We refer to family planning in the field as birth spacing. Yes, there are a number of Muslim countries that have been very successful in expansion of family planning and reducing their fertility rate. I will use Iran as an example. Iran is one of my research areas, and I have studied it extensively. Iran has gone through a fertility transition that has been unprecedented. The fertility transition, I mean the reduction of fertility rate. Iran used to have, it's hard to believe now, but Iran's fertility rate was slightly higher than Afghanistan's fertility rate. Afghanistan is about 6.5, Iran was about 6.7. And they were able to turn this around to bring it below 2.1 in less than a decade. So it's one of those areas that is studied. It's not getting a lot of attention, but it is a great model for the Muslim societies to follow. In the nomadic community that I worked in Kurdistan region of Iran in the late 90s, the community, the families lived in tents. My tent was next to the elder's tent because I was under his protection. So I have my own tent, and all these families had their own tents. And every other week, a jeep would drive up to this community, very difficult to get to. And there was a health worker inside this jeep who carried supplies. And he would come in with immunization, he would come in with contraceptives. And I became friendly with him, and I kept asking him, you know, how does this work? How do you get to this rural community in the mountains? And he said that he had been doing that for about 15 years. There are a number of factors, and one of them is that the clergy came on board. The health professionals took a number of steps, discussed it with the clergy, and the clergy participated in actively. That does not mean that all clergy did it, they participated, but there was enough information and education that the clergy participated and cooperated. Also, involvement of men, something that is very interesting, and I don't know of another country that this strategy is being done. Young men and women in Iran who are going to get married, they have to take a family planning course before they can get their marriage license. So even if these people are not getting the information through the media or the schools, before they're married, they have this mandatory family planning course, and I have sat in these courses. Women receive their own information, men receive their own information. And this has helped women who don't have a lot of education also reach that information. The women who do have education receive that information in universities. It is also interesting to know that in Iran, there's a mandatory family planning course in the university. So if you want to get your degree, you have to pass this course. So imagine these young men and women having the tools and having the information before they start the family. In fact, I suggested this to the Minister of Health in Afghanistan, and I said, this is a great opportunity. We have all these students They're already coming to the classes, and what if we were to talk to them about family planning methods and health of the family and so on? So we try to use the best practices, the experience, mostly regional, what has worked in the region in our programs in Afghanistan.